Legionnaire's disease is a severe form of pneumonia caused by the bacterium Legionella pneumophila, which thrives in warm water environments such as hot tubs, cooling towers, and plumbing systems. People can become infected by inhaling aerosolized water droplets containing the bacteria, often in places like hotels, hospitals, and cruise ships. Symptoms typically appear 2 to 10 days after exposure and may include cough, shortness of breath, high fever, muscle aches, and gastrointestinal issues like diarrhea. Diagnosis is usually made through chest x-rays, blood tests, or urine tests that detect Legionella antigens. Treatment involves the use of antibiotics, such as azithromycin or levofloxacin, which are effective against the bacteria. Prevention strategies focus on maintaining water systems to eliminate Legionella growth, including regular cleaning and disinfection of water sources. Understanding Legionnaire's disease is crucial, especially for healthcare providers, as it can lead to serious complications, particularly in older adults and those with weakened immune systems. Early recognition and treatment are key to improving outcomes for affected individuals. Leprosy, also known as Hansen's disease, is a chronic infectious disease caused by the bacterium Mycobacterium leprae, which primarily affects the skin, nerves, mucous membranes, and eyes. The disease is transmitted through prolonged close contact with an infected person, although it is not highly contagious. Symptoms often develop slowly and may include patches of discolored skin, numbness, and weakness in affected areas due to nerve damage. If left untreated, leprosy can lead to significant disabilities and deformities, particularly in the hands and feet. Diagnosis is typically made through clinical examination and skin biopsies to identify the bacteria. Fortunately, leprosy is treatable with a multi-drug therapy, MDT, that includes antibiotics like rifampicin and dapsone, which effectively kill the bacteria and prevent further transmission. Early treatment is crucial to prevent complications and improve outcomes. Understanding leprosy is important for recognizing its signs and symptoms, promoting awareness, and reducing stigma associated with the disease, as well as ensuring access to treatment for those affected. Listeria meningitis is a serious infection of the protective membranes covering the brain and spinal cord, caused by the bacterium Listeria monocytogenes. This infection is particularly concerning for certain high-risk groups, including pregnant women, newborns, the elderly, and individuals with weakened immune systems. Listeria is often found in contaminated food, such as unpasteurized dairy products, deli meats, and raw vegetables, making it crucial to practice safe food handling and preparation. Symptoms of Listeria meningitis can include fever, headache, stiff neck, confusion, and other neurological signs, which may develop gradually. Diagnosis is typically confirmed through a combination of clinical evaluation, blood tests, and lumbar puncture, spinal tap, to analyze cerebrospinal fluid. Treatment usually involves intravenous antibiotics, such as ampicillin or gentamicin, and early intervention is essential to reduce the risk of severe complications. Understanding Listeria meningitis is vital for healthcare providers to ensure prompt recognition and treatment, especially in vulnerable populations, and to promote food safety practices to prevent infection. Liver cysts caused by Echinococcus infection, known as echinococcosis or hydatid disease, are the result of infection with the Echinococcus tapeworm, which typically comes from ingesting contaminated food or water, or through contact with infected animals, particularly dogs. The infection leads to the formation of fluid-filled cysts in the liver, which can grow large and cause symptoms such as abdominal pain, nausea, and jaundice if they compress surrounding structures. Diagnosis is generally made using imaging techniques like ultrasound or CT scans, which can reveal the characteristic cysts. Treatment may involve surgical removal of the cysts or the use of anti-parasitic medications, such as albendazole, depending on the size and location of the cysts and whether they are causing symptoms. Understanding liver cysts due to echinococcus infection is crucial, especially in regions where the parasite is endemic, as early diagnosis and treatment can prevent complications and improve outcomes for affected individuals. Public health education on hygiene and responsible pet ownership is essential to reduce transmission and prevent infections. Lyme disease is an infectious illness caused by the bacterium Borrelia burgdorferi, which is transmitted to humans through the bite of infected black-legged ticks, commonly known as deer ticks. The disease is most prevalent in wooded and grassy areas during warmer months when ticks are active. Early symptoms often include a characteristic bullseye rash, erythema migrans, fever, chills, fatigue, muscle and joint aches, and swollen lymph nodes. If left untreated, Lyme disease can lead to more severe complications, such as joint pain, neurological issues, and heart problems. Diagnosis is usually based on clinical symptoms, history of tick exposure, and sometimes laboratory tests that detect antibodies to the bacteria. Treatment typically involves antibiotics, such as doxycycline or amoxicillin, which are highly effective, especially when started early. Understanding Lyme disease is important for prevention, which includes using insect repellent, wearing protective clothing, and conducting tick checks after outdoor activities, particularly in endemic areas. Awareness and education about Lyme disease can significantly reduce the risk of infection and promote early recognition and treatment. Malaria is a life-threatening disease caused by parasites of the Plasmodium species, transmitted to humans through the bites of infected female Anopheles mosquitoes. It is most common in tropical and subtropical regions, particularly in parts of Africa, Asia, and South America. Symptoms typically appear 9 to 14 days after infection and can include high fever, chills, sweating, headache, nausea, vomiting, and fatigue. If not treated promptly, malaria can lead to severe complications, including anemia, respiratory distress, and organ failure. Diagnosis is usually confirmed through blood tests that detect the presence of the parasite or its antigens. Treatment involves the use of anti-malarial medications, such as artemisinin-based combination therapies, ACTs, which are effective in killing the parasites. Preventive measures are crucial and include the use of insecticide-treated bed nets, indoor spraying with insecticides, and prophylactic medications for travelers to high-risk areas. Understanding malaria is vital for public health, as effective prevention and treatment strategies can significantly reduce morbidity and mortality associated with this disease. Measles is a highly contagious viral infection caused by the measles virus, which spreads through respiratory droplets when an infected person coughs or sneezes. The disease is characterized by several key symptoms, including high fever, cough, runny nose, and a distinctive red rash that typically starts on the face and spreads to the rest of the body. Measles can lead to serious complications, especially in young children and individuals with weakened immune systems, including pneumonia, encephalitis, inflammation of the brain, and even death. Diagnosis is usually made based on clinical symptoms and history of exposure, but laboratory tests can confirm the infection. The best way to prevent measles is through vaccination with the measles, mumps, and rubella (MMR) vaccine, which is highly effective and part of routine childhood immunization schedules in many countries. Understanding measles is crucial for healthcare providers, as increased awareness and vaccination efforts are essential to prevent outbreaks and protect vulnerable populations from this serious disease. Mononucleosis, often referred to as mono, is an infectious disease most commonly caused by the Epstein-Barr virus, EBV, a member of the herpes virus family. It is primarily transmitted through saliva, which is why it is sometimes called the kissing disease, but it can also spread through other forms of close contact or sharing drinks and utensils. Symptoms typically include extreme fatigue, sore throat, swollen lymph nodes, fever, and sometimes an enlarged spleen or liver. Diagnosis is usually based on clinical symptoms, blood tests that detect antibodies to EBV, and sometimes a complete blood count showing an increased number of lymphocytes. Most cases of mononucleosis are self-limiting, meaning they resolve on their own with rest and hydration, but it is important to avoid contact sports to prevent spleen rupture if the spleen is enlarged. Understanding mononucleosis is essential for healthcare providers, as it helps in recognizing the condition, providing appropriate care, and advising patients on recovery and activity restrictions. Mucormycosis, also known as zygomycosis, is a rare but serious fungal infection caused by a group of molds called Mucormycetes. This infection typically occurs in individuals with weakened immune systems, such as those with diabetes, cancer, or severe malnutrition, as well as in patients who have undergone organ transplants or have been on long-term corticosteroid therapy. Mucormycosis can affect various parts of the body, but it most commonly manifests as a sinus infection that can spread to the brain, lungs, or skin. Symptoms may include facial swelling, nasal congestion, fever, and black lesions in the nasal cavity or on the skin. Diagnosis involves imaging studies and tissue biopsies to identify the fungus. Treatment is urgent and typically requires a combination of antifungal medications, such as amphotericin B, and surgical intervention to remove infected tissue. Understanding mucormycosis is critical for healthcare providers due to its rapid progression and high mortality rate, emphasizing the importance of early detection and aggressive management in at-risk patients. Mumps is a contagious viral infection caused by the mumps virus, which primarily spreads through respiratory droplets when an infected person coughs or sneezes, or through direct contact with saliva. The hallmark symptom of mumps is swelling of the parotid glands, which are located near the jaw, leading to a characteristic puffy appearance on one or both sides of the face. Other symptoms may include fever, headache, muscle aches, fatigue, and loss of appetite. Mumps can lead to complications such as orchitis, swelling of the testicles, oophorytis, swelling of the ovaries, meningitis, and hearing loss, although these are less common. Diagnosis is typically based on clinical symptoms and history of exposure, but lab tests can confirm the infection. The best way to prevent mumps is through vaccination with the measles, mumps, and rubella MMR vaccine, which is highly effective. Understanding mumps is important for healthcare providers to ensure proper diagnosis, management, and vaccination strategies, especially in communities where vaccine coverage may be low, potentially leading to outbreaks. Neisseria gonorrhoeae is a bacterium responsible for gonorrhea, a sexually transmitted infection that can lead to various complications, including septic arthritis. Septic arthritis occurs when bacteria infect the joints, causing inflammation, pain, swelling, and reduced mobility. In cases related to gonorrhea, the infection typically spreads to the joints from the urogenital tract, particularly in sexually active individuals. Symptoms of septic arthritis include intense joint pain, fever, and warmth over the affected joint, often presenting in the knees, hips, or wrists. Diagnosis is usually made through joint fluid analysis, where a sample is taken via arthrocentesis and tested for the presence of the bacteria, along with other tests to rule out other causes of arthritis. Treatment involves the use of antibiotics to target Neisseria gonorrhoeae, along with possible drainage of the infected joint to relieve pressure and pain. Understanding the connection between Neisseria gonorrhoeae and septic arthritis is crucial for healthcare providers, as early recognition and treatment can prevent long-term joint damage and improve outcomes for patients. Neisseria meningitidis, commonly known as the meningococcus, is a bacterium that causes meningitis, an infection of the protective membranes covering the brain and spinal cord. This serious condition often begins with flu-like symptoms such as fever, headache, and a stiff neck, but can quickly progress to more severe signs, including confusion, sensitivity to light, and a rash that may appear as small, red, or purple spots, petechiae, on the skin. Meningococcal disease can be life-threatening, and prompt diagnosis is crucial, usually involving a lumbar puncture to analyze cerebrospinal fluid, along with blood cultures. Vaccination is a key preventive measure, as several meningococcal vaccines are available to protect against the most common strains of the bacterium. Understanding Neisseria. Meningitis is essential for healthcare providers, as early recognition and treatment with appropriate antibiotics can significantly reduce morbidity and mortality associated with this infection, emphasizing the importance of vaccination and awareness, especially in high-risk groups like college students and military recruits. Pinworm infection, also known as enterobiasis, is a common parasitic infection caused by the small white roundworm Enterobius vermicularis, primarily affecting children. The infection is spread through the ingestion of pinworm eggs, which can be found on contaminated surfaces, clothing, or bedding. Once ingested, the eggs hatch in the intestines, and adult worms reside in the rectum, where female worms lay their eggs around the anal area, often causing itching and discomfort, particularly at night. Other symptoms may include irritability, difficulty sleeping, and occasionally abdominal pain. Diagnosis is typically made through a tape test, where a piece of clear tape is applied to the anal area to capture eggs, which are then examined under a microscope. Treatment usually involves over-the-counter or prescription medications, such as mebendazole or albendazole, which effectively kill the worms. Understanding pinworm infection is important for healthcare providers to ensure proper diagnosis, effective treatment, and education on hygiene practices to prevent reinfection, such as frequent hand washing and keeping fingernails short, especially in children. Rabies is a viral disease caused by the rabies virus, which is usually transmitted through the bite of an infected animal, most commonly dogs, bats, and raccoons. Once the virus enters the body, it travels along the nerves to the brain, where it can cause severe neurological symptoms. The early signs of rabies may include fever, headache, and general malaise, but as the disease progresses, it can lead to anxiety, confusion, agitation, hallucinations, and paralysis. One of the most distinctive symptoms is hydrophobia, or fear of water, due to difficulty swallowing. Rabies is almost always fatal once symptoms appear, making timely medical intervention crucial. If a person is bitten by a potentially rabid animal, post-exposure prophylaxis, PEP, with a rabies vaccine and rabies immune globulin can effectively prevent the onset of the disease if administered promptly after exposure. Understanding rabies is vital for healthcare providers to ensure proper management of animal bites, educate the public about prevention through vaccination of pets, and recognize the importance of immediate treatment to save lives. Ringworm, medically known as tinea, is a common fungal infection that affects the skin, hair, or nails. Despite its name, ringworm is caused by various types of fungi, not worms. The infection is characterized by round, red, scaly patches that may be itchy and can spread to other areas of the body or to other people through direct contact or contaminated surfaces, such as towels or gym equipment. Different types of ringworm are named based on the affected area: Tinea corporis, body; Tinea capitis, scalp; Tinea pedis, athlete's foot; and Tinea cruris, jock itch. Diagnosis is usually made based on the appearance of the rash, but sometimes a skin scraping is examined under a microscope to confirm the presence of fungi. Treatment typically involves antifungal medications, either topical, creams, or ointments for mild cases, or oral medications for more extensive infections. Understanding ringworm is important for healthcare providers to ensure accurate diagnosis, effective treatment, and education on prevention strategies, such as maintaining good hygiene and avoiding sharing personal items. Rocky Mountain Spotted Fever, RMSF, is a serious bacterial infection caused by Rickettsia rickettsii, primarily transmitted through the bites of infected ticks, especially the American dog tick and the Rocky Mountain wood tick. This illness is characterized by a sudden onset of fever, headache, and muscle pain, often accompanied by a distinctive rash that typically appears a few days after the initial symptoms and starts as small, flat red spots that can become raised and spread to cover most of the body. If left untreated, RMSF can lead to severe complications, including organ failure and even death. Diagnosis is often based on clinical symptoms and history of tick exposure, but laboratory tests can confirm the infection. Treatment involves the use of antibiotics, most commonly doxycycline, which is most effective when started early in the course of the disease. Understanding Rocky Mountain Spotted Fever is crucial for healthcare providers to ensure prompt diagnosis and treatment, emphasize the importance of tick prevention strategies, and educate at-risk populations about the symptoms and dangers of this potentially life-threatening infection. Shingles, also known as herpes zoster, is a viral infection caused by the reactivation of the varicella zoster virus, the same virus responsible for chickenpox. After a person has chickenpox, the virus lies dormant in the nerve cells and can reactivate later in life, often due to stress, weakened immunity, or aging. Shingles is characterized by a painful, blistering rash that typically appears on one side of the body or face, following the path of a nerve. It may be accompanied by symptoms such as itching, burning, and sensitivity in the affected area, as well as fever and fatigue. The rash usually lasts 2 to 4 weeks and can lead to complications, including post-herpetic neuralgia, where pain persists even after the rash has healed. Diagnosis is based on the appearance of the rash and the patient's history. Antiviral medications, along with pain relief measures, are key components of treatment, and vaccination can help prevent shingles or reduce its severity. Understanding shingles is important for healthcare providers to ensure timely diagnosis, effective management, and education about prevention through vaccination, especially for older adults and those with weakened immune systems. Strongyloidiasis is an infection caused by the parasitic roundworm Strongyloides stercoralis, commonly found in tropical and subtropical regions. The infection occurs when larvae penetrate the skin, often through bare feet, and migrate through the bloodstream to the lungs, where they can be coughed up and swallowed eventually reaching the intestines. Symptoms can vary widely. Some people may remain asymptomatic, while others may experience abdominal pain, diarrhea, nausea, and weight loss. In severe cases, particularly in individuals with weakened immune systems, the infection can lead to a hyperinfection syndrome, characterized by a rapid increase in the number of parasites, potentially causing life-threatening complications. Diagnosis is typically made through stool tests to detect the presence of larvae or through serological tests. Treatment usually involves antiparasitic medications, such as ivermectin, which effectively eliminate the infection. Understanding strongyloidiasis is crucial for healthcare providers to ensure proper diagnosis, treatment, and awareness of the risks associated with this infection, especially in at-risk populations, such as immunocompromised individuals or travelers to endemic areas. Systemic mycoses are a group of serious fungal infections that affect the entire body, often involving the lungs, and can spread to other organs. These infections are usually caused by fungi that are typically found in the environment, such as Histoplasma capsulatum, Coccidioides immitis, and Blastomyces dermatitidis. People can become infected by inhaling the fungal spores, especially those with weakened immune systems, such as individuals with HIV/AIDS, cancer, or those on immunosuppressive therapies. Symptoms often resemble those of pneumonia and may include cough, fever, chest pain, fatigue, and difficulty breathing. Diagnosis usually involves a combination of clinical evaluation, imaging studies, and laboratory tests, including cultures or serological tests to detect the fungi. Treatment typically requires prolonged courses of antifungal medications, such as amphotericin B or itraconazole, and may vary depending on the specific fungus and severity of the infection. Understanding systemic mycoses is essential for healthcare providers to ensure timely diagnosis and effective management, especially in at-risk populations, as these infections can be life-threatening if not treated promptly. Toxoplasmosis is an infectious disease caused by the parasite Toxoplasma gondii, which is commonly found in cat feces, contaminated food, and soil. Most healthy individuals may experience mild or no symptoms at all, but the infection can cause flu-like symptoms such as fever, muscle aches, and fatigue, and it can lead to more severe complications in individuals with weakened immune systems or during pregnancy. In pregnant women, toxoplasmosis can result in serious consequences for the fetus, including brain damage and eye problems. Diagnosis is typically made through blood tests that detect antibodies to the parasite, or through imaging studies in cases of severe illness. Treatment may involve the use of specific antibiotics, especially in immunocompromised patients or pregnant women, to reduce the risk of complications. Understanding toxoplasmosis is crucial for healthcare providers to ensure proper diagnosis, educate patients about prevention, such as avoiding raw or undercooked meats and practicing good hygiene when handling cat litter, and to manage the risks associated with this infection, particularly in vulnerable populations. Visceral leishmaniasis, also known as Kala-Azar, is a severe form of leishmaniasis caused by the protozoan parasite Leishmania donovani, primarily transmitted through the bites of infected sandflies. This disease primarily affects internal organs, especially the spleen, liver, and bone marrow, leading to symptoms such as prolonged fever, weight loss, anemia, and swelling of the spleen and liver. If left untreated, visceral leishmaniasis can be fatal, making early diagnosis and treatment crucial. Diagnosis is often confirmed through blood tests to detect the parasite or its DNA, as well as bone marrow aspiration or other tissue samples. Treatment typically involves anti-parasitic medications, such as liposomal amphotericin B or pentavalent antimonials, which are effective in managing the infection. Understanding visceral leishmaniasis is important for healthcare providers to ensure timely diagnosis, appropriate treatment, and education about prevention measures, particularly in endemic regions where sandfly exposure is common and where the disease can have significant public health implications. Yellow fever is a viral disease caused by the yellow fever virus, which is transmitted to humans through the bite of infected mosquitoes, primarily the Aedes aegypti mosquito. The disease is endemic in tropical and subtropical regions of Africa and South America. Symptoms typically appear 3 to 6 days after infection and can range from mild flu-like symptoms, such as fever, chills, loss of appetite, and muscle pain, to severe cases that include high fever, abdominal pain, liver damage, and bleeding from the nose, mouth, or eyes, often leading to a high mortality rate. Diagnosis is based on clinical symptoms and history of travel to endemic areas, and laboratory tests can confirm the presence of the virus. There is no specific antiviral treatment for yellow fever, so prevention through vaccination is crucial. The yellow fever vaccine is highly effective and provides long-lasting immunity. Understanding yellow fever is essential for healthcare providers to ensure proper diagnosis, management, and education about vaccination and mosquito control measures, particularly for travelers to endemic regions.